So first, let's think about reimbursement for digital health programs through a model that looks like durable medical equipment.
Absolutely. The first model is a lot of what folks think about when they first want to commercialize these digital products. So, durable medical equipment itself means that the product is dispensed for use outside of the healthcare setting, most often in the home. It has a life of at least 3 years. It's able to be used by more than one patient, and it's used for a medical purpose. And also, kind of a footnote to that, it has to be an FDA defined medical device, not necessarily a cleared medical device, but one that meets the definition of a device. An example might be we at Everson have been working with some companies that have done it with VR. They have this standalone device, which is always helpful when we're talking about DME, and having that standalone VR device has helped them get into the DME space.
That's very helpful, Brian. So in that model, is there a specific DME code set? Where's the reimbursement for DME coming from?
When we're talking about Medicare, the coding is actually from CMS. Even beyond Medicare, you would usually use what we call a HCPCS code. When we talk about DME, it's one of those 5-digit codes that starts with an E. It is issued by CMS. It seems straightforward, but there are some nuances to it. Over the past couple of years, CMS has also added onto that whether or not you would qualify as DME, and also what your pricing would be. And so all of those things combined in that one DME application to CMS are going to be evaluated at least during one cycle, if not more than one cycle by CMS, evaluation cycle, which happens twice a year. What they would do is basically look for the qualifications for DME first as the coding is applied for. And then if there is evidence that they can look to pricing, they'll also look for that and start the DME fee schedule process as well, so that the product could appear on the Medicare DME fee schedule. As Medicare chooses its payment level for DME, commercial insurers, other payers can choose whatever they want, even if it's attached to that same HCPCS code, that same healthcare common procedural coding system code. Just because it has a certain price at CMS doesn't mean that that payment is the same with other payers.
With the VR example, you hit an interesting requirement, right? So a VR company could take just their software to market. We'll talk about other models, but really, if they wanted to go through the DME model, it has to actually commercialize the hardware with it. What are some of the other implications? Maybe we could talk a little about who actually can sell DME and some of the distribution.
Sure. So we look to suppliers or distributors to sell DME. And interestingly, physicians are automatically qualified as suppliers. It's just whether or not they actually want to stock these things and sell them. But basically, what would have to happen is a supplier would have to be qualified by CMS to distribute the product and then would accept the payment on the fee schedule.
So to summarize, the manufacturer of the digital product that wants to go through DME theoretically could become a supplier, but often the manufacturers are not the suppliers themselves. So you got to think about another a player in the channel who's actually going to distribute the physical product for you.